Friends, welcome to Sebe. Today we are going to see few legal aspects, that is the applicability of action rules towards occupational safety and health with reference to the impact of COVID-19 in India. Before going to that, let us also revise or bring to the forefront that there is a mutually combined responsibility of employer and employees in upholding various acts and rules applicable to occupational safety and health. See, my friends, employers have not only invested money on plant and machinery, they have invested money on workforce also. They would like that their workforce should be knowledgeable. They should be able to assess their workplace continuously, remove the hazards, reassess and remove the risk if any immediately without waiting for any accident to happen. As we are aware, accident bring lot of difficulties both for the employer and the employee. Therefore, reduction of accidents, reduction of wastages and improvement of workplaces to ensure a decent work is the prime concern both for the employer and the employee. And in our country, both the employer and the employee are working jointly to achieve this goal. In spite of this, sometimes accidents do happen. That only shows that we, that is the safety and health professionals, must be more alert in promoting occupational safety and health aspects and update or improve the knowledge base of employers as well as the employees. This is one aspect. Now let us come to the two important acts which are being used now for containment or spread of the virus. The first one is Disaster Management Act 2005. The second act is the Epidemic Disease Act 1897. Though it is enacted in 1897, it is still relevant in our country and being used at regular intervals. Recently, this act was used in 2009, 2015 and in 2018 also. This Epidemic Disease Act is now applicable, is being used in all the states and union territories of India to contain COVID-19. This act prescribes temporary regulations to prevent the virus. Both the central and state government can prescribe regulations which includes inspection of ships and vessels. All the offences under this act are punishable under Indian Penal Code, and suitable protective or protection to persons acting in good faith is also given under Section 4 of this Act. Apart from this, recently this Epidemic Disease Act 1897 is amended to protect healthcare service personnel and their property, including their living, I repeat, including their living property, that is their houses, homes and working premises, from any violence. Now, it is more stringent enough to deter mischief makers and a landmark provision. The status of factory medical officers is not clearly defined in my opinion, but any medical officer, any healthcare service personnel who is treating COVID-19 patients has to be covered under this act. Therefore, the factory medical officers and their associated healthcare service personnel are also covered under this, which is my opinion. Further, it is not only that healthcare service personnel are covered here, but there is another phase to this. Any employer or any employee who is defying the instruction given by the government, or if they are refusing to follow the protective measures as prescribed by the government, must be prosecuted under this act. there is an immediate need for this, because we are all aware that the second wave of infection and the third wave of infection will be coming to our country also. To contain second and third waves, which may happen in the next 12 to 14 months, we have to be more alert and try to contain, try to identify, try to remove all the virus in the first wave itself, so that we are saved from the second and third waves. Coming to the Disaster Management Act, we have to remain safe, make our hospitals safe and functional during and after the disasters, that is during and after the infection spread, in particular to preparedness, response and recovery procedures. Absolute responsibilities are to be assigned to the individual persons. A similar act is also in force in the United States of America, which is called Stafford Act, Stafford Disaster Relief and Emergency Assistance Act. Apart from this, we have our ongoing general act and rules, which are more in numbers, which we will be taking up or discussing in our next post. Thank you for listening.